right. Good morning, everyone, and welcome to our April 15, 2026 LEOFF Board meeting. Go ahead and call it to order, and let's take a moment of silence to remember our fallen brothers and sisters since our last meeting. All right, thank you very much. On our agenda, we've got a good agenda today, and I think starting off first of all, historic in some senses, right? We got Jacob here in his new role, officially in that capacity now for a few days, and congratulations to you. And Dave, I know you moved to the back. Welcome to our team. Thank you for joining us. So it's going to be looking forward to working in the future with you. Item number 1 on our list is the approval of our December 2025, January, February, and March 2026 minutes. They're presented for your approval. Is there a motion?
So moved.
It's been made. Is there a second? Motion is made and seconded to adopt the minutes as presented. All those any discussion, comments? Not seeing any. All those in favor say aye.
Aye. Aye.
Opposed? All right, passes 3-0. And we do have a quorum, just so you're aware. All right, item number 2 on our list is the Public Safety Officer Benefit PSOB briefing, and I'll turn over to Tammy. Tammy can do the introductions. Good morning, Tammy. Thank you.
Hi, good morning. Thank you. For the record, I'm Tammy Sadler, staff to the board, and today I'm going to be presenting on federal disability benefits. This is an overview. There's no action necessary for the board. It's simply a briefing, and we'll do some Q&A at the end if you have any questions. I have with me today experts in federal benefits through the Public Safety Officers Board, and so I'd like to introduce Chris Gorman with the Lacey Fire, and I did. It just totally slipped. It just slipped. Pat Ellis with Kent, but it's not Kent anymore. It's Puget Sound Regional Fire Authority. Thank you so much. Oh my gosh, I can't believe I've worked with Pat since the beginning of my career as an ombudsman. He actually did some mentoring for me way back in the day, and really helped me understand federal benefits at a deeper level. And so that was really embarrassing. We can laugh about it. Hey, you know what? He's out of here in a few months, so it's all good. We'll just let this slip under the rug, and I'll forget Chris's name next time. All right. In the meantime, so we're going to go over these federal benefits. There has been some changes recently in congressional legislation, and so that's why I'm bringing this to the board, is to not only make you aware of the overall benefits of the program, but to also make you aware of these changes so that you can go back to your membership and share this with them. But first, I want to just kind of remind everybody what the LEOFF 2 Ombudsman program is all about. Jessica and I are specialized in the field of death and disability benefits. We assist members from the time that they are injured all the way through either returning to work or having to retire due to that disability. And so we help them with local, state, and federal benefits. We provide them information, options, and resources when they have been hurt or killed in the line of duty. So just kind of wanted to remind you of why this is in my field of expertise. So here on this next slide, I have the federal benefits program, just kind of an overview of it. It's a federal program under the Department of Justice. It serves local, state, tribal, and federal public safety agencies, as well as other national organizations. They provide benefits for not just financial benefits, but also education benefits for line of duty deaths and catastrophic line of duty disabilities. A little bit of history on the PSOB benefits. It was enacted back in 1976. And at that time, the benefits were only for physical injuries, like accidents that happened. There was a modest $50,000 benefit, which increased to $100,000 in 1988. Then in 2023, heart attacks and strokes while on duty were added as eligible injuries. And then in 2020 or 2006 and 2008, between that time frame, they widened it to include heart attacks. Nope, that's not. They updated the regulations to add the education benefits is what they did at that time. And then, of course, they responded to crises that happened with 911 and the exposures to those who were helping other first responders and in the 911 incident. And then when COVID happened, they responded to the exposures that people were having to COVID. Those were temporary benefits and are no longer part of the benefit packages for them. In 2022, the coverage was expanded to include PTSD when officers have committed suicide or attempted to commit suicide. And we'll go a little bit deeper into those later on in the presentation. And then in 2025, just this last December, which is the reason for this presentation, is that the coverages were expanded to include certain cancers. Just like we have presumptive cancers here in the state of Washington, we now have presumptive cancers in the federal program. So this slide here just tells you a little bit about who is covered under the PSOB and benefits, the definition of public safety officers. I won't go into, there's deeper definitions of what each of these mean, just like we have in our own state laws. So I won't go into any of that today, but if anybody has a question about what that entails, I'm happy to provide that to them. The current PSOB benefit as of October 1st, and it does get adjusted every October 1st annually. Currently for October 1st through September 30th of 2026, the benefit is $4,600 and, well, you can see it up there. And then for educational benefits, that's a monthly benefit. And there is no minimum service required in order to be eligible for these benefits, except for in the case of cancer claims. And we'll review that a little bit later. This slide here, I just wanted to give you the definition of what an injury entails. It's not just, it's blunt force, trauma, explosives, sharp objects, chemicals, all kinds of nasty exposures that people in that field of work get exposed to. Here, we're going to go a little bit deeper into the actual coverages for heart attacks, strokes, and vascular ruptures. If an officer has been engaged in a non-routine, stressful, or strenuous physical activity as part of an emergency response or a training exercise, and if the condition began during that physical activity, and if the officer remained on duty after the physical activity or within 24 hours of the activity. Here in Washington State, it's within 72 hours of exposure to smoke, fumes, and toxic substances. So you'll see there's a little bit of difference between what the federal benefits offer, their eligibility, and my screen just went blank. Jesse, can you help me out? Oh, it came back. And what the state coverages are. There we go. I'm back, baby. All right, for presumptive coverages for PTSD or mental health, that's they have coverage for suicide or, like I said, attempted suicide. And then there are specific conditions that need to be met for eligibility, which includes the exposure being a substantial factor in the action, or that it occurred within 45 days of the exposure, and that it's not inconsistent with with a psychiatric disorder. And I apologize for the double negative. It's just the way the federal government they write things. And you're going to see, and I have another slide that's like that too. And I tried real hard. For exposures and cancers, there are two different types of carcinogens that are considered a public safety risk, and they are classified by the International Agency for Research and Cancer. Group 1 means that it's carcinogenic to humans, and group 2, it's probably carcinogenic to humans. So if the chemicals or substances that the officer was exposed to falls into one of those two groups, then that assists in the eligibility process. Certain cancers that were put into place in December of 2025. I just kind of want to highlight a few of these things. These presumptive coverages aren't just for firefighters like they are here in the state of Washington. They are for all public service officers. They need to have 5 years worth of active service versus 10 years here in Washington state. If they're no longer active, they must be diagnosed within 15 years of their active duty, where it's 5 years here in the state of Washington. And this is the slide where that last bullet, it's super confusing, and I apologize, but that's the way that it was explained to Congress, and I didn't want to change any language and therefore accidentally change the meaning of it. Here's the list of eligible cancers for that the PSOB covers. The blue highlighted ones are ones that are different than the state of Washington. You'll notice the breast cancer is on there, but the reason I put that in blue is because in the state of Washington, that's only for women, and it's for both women and men at the PSOB level. The other thing I wanted to point out is that the WTC related cancers, that's the World Trade Center related cancers. So I'm going to spell that out for you. And also those are regulated by the CDC, and there's a link on our website to point you to those more specifically. For education benefits, they are available for eligible spouses and children up to the age of 27. Like I said, it's a monthly benefit. There's no age limit for spouses. If the child is beyond the age of 27, there are some circumstances where the benefits can be extended. They must be enrolled in an eligible institution, and there is a limit of 45 months that the benefit will be paid out. I just, again, want to make the board aware that the eligibility criteria is entirely different from Washington state. So it is possible that if somebody is approved for a benefit here in the state of Washington for the same thing, that they might not be approved by PSOB and vice versa. So this is something that our members want to apply for, regardless of whether they were eligible here in the state of Washington, because you just never know. There are deadlines for applying for these benefits. For general death and disability, it's 3 years from the date of the injury. or 1 year from the determination of an agency level benefit, whichever's later. And the reason that they have that on there is because sometimes people don't know of these benefits. And so if they're waiting for the state, that can take a long time for the state to make a determination sometimes on these benefits. And so having that, the security of knowing that there was, that it was deemed a work-related injury or illness, it just helps their eligibility for PSOB, even though the eligibility criteria may be different. So it just gives them a little bit extra time to to apply that. They're not having to go through two processes at the same time too. So I really appreciate that PSOB allows the whichever is later. The PTSD and the mental health. Is also 3 years from the date of exposure or 1 year from the workers' compensation or disability retirement due to the condition. So since this is a new benefit, there are several unknowns right now. So the Congress passed this law, and now the PSOB has to figure out how to administer the law. And so they're working on their processes. Chris just recently went to Baltimore and met with PSOB, so he has a little bit more information now that he can share with us. He did share with me that on bullet 3, you'll notice that I said it's unknown at this time about the application deadline for retroactive benefits. I did learn this morning that that is December of 2028. So they're allowing it from 3 years from the date that the cancers were allowed, which was December of 2025. So now we're looking at December of 2028 to give people time to apply for those retroactive benefits. It does go back to January of 2020, which is a significant amount of time. I love that. I love that. We want members to go ahead and start, even though PSOB doesn't have a official procedures for these benefits, we are encouraging them to apply for the benefits now. And this is kind of the overview of the application process. There's a lot involved. It's not just the applicant themselves, but it's the agencies. They both have to create online accounts and complete their applications and submit required documents. And then PSOB has a ton of processes that they go through on their end to make their determination. And these claim determinations can take 1 to 3 years to be completed. And so it is quite a long and complex process, which is why we have state experts that we want to direct our members to, so that they don't have to go through this alone. Just like when they're injured or when they're hurt or killed in line of duties, them and their families don't have to be alone. They can come to the Ombudsman program. For these federal benefits, we have experts that they can go to and be supported, and they will actually file the claims for them. They will act as their personal representative. So I'm going to turn this over to Chris and Pat and let them speak to their program and correct anything that I said wrong in my slides earlier.
All right, thank you. What was Tammy?
Tammy.
Yes, okay, thank you. My name is Pat Ellis. I am the Crisis Intervention Coordinator and Chaplain for Puget Sound Fire. I've been with the department 26 years. I've been working with line of duty death and the fire service now in the state of Washington for almost 20 years. And I am the coordinator for the last team for the state of Washington for the next 3 months. And then I retire 3 months today. So not that I'm counting. Chris Gorman will be taking my place. So just as a understanding, the National Fallen Firefighters Foundation created a program called LAST, Local Assistance State Team. Every state has a LAST team. The purpose of the LAST team was primarily filling out PSOB claims on behalf of the families and the departments. Our team here in Washington not only does that, but we also oversee and coordinate all of the line of duty death funeral services for the fire service here in the state, and with the Washington State Fallen Firefighters Memorial Foundation as part of that as well. So I've been overseeing that program for about 20 years now, and over those years have filed several, a lot of PSOB claims, and have learned a lot about the process, which can be very complicated, and yet at the same time, it's pretty intuitive and pretty simple the way they have their things set up. The complication comes with working with people and families and departments. And I'll touch base on that. And so we've gone through training through the National Fallen Firefighters Foundation and the PSOB office to be able to file these claims, then understand the nuances, the information that's needed, and different things that are required for the PSOB applications. And I will tell you, having one point of contact for these claims is absolutely vital. The department can fill out, when you fill out a PSOB claim, there's two parts, Part A and Part B. Part A is for the family, Part B is for the department. And they can file those individually, and then PSOB claim office puts those two together. Having one point of contact to file that claim, what that does is that reduces a tremendous amount of confusion that can happen between Part A and Part B. And a lot of that has to do with, again, family. So when you have a claimant, is usually the legal next of kin, for conversation purposes, we'll say that's the spouse. If that family has children that are minors, under the age of 18, they are also claimants. So you could have 2, 3, 4, 5 claimants, depending on how many children are involved in that claim. If they're over the age of 18 and they're a full-time student, they're also a claimant. So if the family files the claimant as there's 4 claimants and the department files only 1 claimant, then it gets really confusing and back and forth. And so having one point of contact, we're able to collect all of the information that is needed to be able to file these claims. And it gets very specific, especially in the cases of divorces and remarriages. The PSOB office requires divorce decrees for all of the divorces in the past on both the spouse and the public safety officer. So if you know anything about firefighters, that can get complicated as well. And so there's a lot of that information that we have to collect. And then as the claim moves through the process, the PSOB office will then come back and say, hey, we need more information on this, or we need more clarification on this. Having one point of contact, again, cuts down that confusion to where we can have one point of contact that can answer those questions immediately, contact the right people for those things, and work with the family and the department. So having somebody like us, myself or Chris, be able to be that point of contact, it actually really helps that claim through that process a lot. And just a way of information, we had 2 PSOB claims that were approved because of COVID deaths. We had 3 volunteer firefighters that died of COVID, no career firefighters died of COVID during that time that I'm aware of. We have 2 PTSD claims that are working. One is in the last steps. And like Tammy said, it can take anywhere up to 3 years. Yes, it does. The federal government doesn't do anything quickly. And there's a lot of steps that these move through. Since cancer has now been included, we immediately had 19 cancer cases that we were going to submit to PSOB. We're now up to 23. And part of that is because with Washington State, the only cancers that we track for line of duty are career firefighters because they're eligible for LNI benefits. Volunteer firefighters are not covered by LNI, therefore are not covered by our presumptive laws. So we don't track those. And now, since this law has been passed, we're able to go back and look at volunteer firefighters now who have died of cancer, because they are now eligible for PSOB as well. And so there's some that we know of, some that we don't, and we're just finding out about. So our numbers are continuing to increase. So we're working those claims right now and putting those claims together. A couple of other comments too on the cancer list. There's 19 cancers that Tammy showed, but they also said the World Trade Center cancers. And the catch with that is the firefighter does not have to have been deployed to the World Trade Center. So if they die of a cancer that is related to a World Trade Center cancer, they're eligible for that PSOB claim, even if they were not at the World Trade Center, which now opens the door for pretty much, I'm not going to say all cancers, but a huge list of cancers.
Pat, does that include police officers too? That
Yes, it does. Yes, it does. It does include police officers. With the thing with the police officers, it's with cancer, you have to show the exposure. So with a firefighter, we send in the run report. They went to this fire at this date. Here's the run report that shows their name. Police officers, it's a little bit more difficult to show that. We know that they're at fires because they're often there. The first one's there is like, oh my gosh, this part building's on fire, right? Could get fire here. So they're exposed to that, but we have to go back and show that. And so I've got 2 police officers that I know of that have died of cancer that are eligible, and we're working through those things right now. And we're more than happy to work with those police officers. Behind the Badge oftentimes does that, but I'm not aware of what they're doing with police officers and cancer with PSOB. So, so we're working through all of those things, and it's a good process. Our firefighters deserve this, and I'm excited to be a part of this. So, Chris, anything I'm leaving out?
No, I think, so I've basically been shadowing Pat for the last, I don't know, couple years maybe, shadowing him when it comes to doing the line of death duty services. And now I'm learning all the cancer stuff, and we just got back from Baltimore, and it was a really helpful meeting. And so, yeah, looking forward to working with our departments. Really, our goal is, as Pat said, just to come alongside departments and assist them in taking care of these details. So, yeah, looking forward to it.
Yeah. Questions that anybody has about PSOB, the process, what we do, how we're dealing with it?
Go ahead, Daryl.
I have a question regarding the PSOB deadlines. If hypothetically, if an individual is in the process with the LNI or the self-insured agency, in the process of, I guess, settling a claim, do they have to wait? Or can they contact you? Because some of these claims can take 5, 6, 7 years.
Exactly.
Do they have to wait for that claim to be finished? And if not, they can contact you. Will these benefits come into play if will the feds determine that they're eligible even though LNI hasn't?
Right. Good question. The PSOB office does not follow or are linked to the states. So LNI, no. So the question is, if they have a claim in process, no, we don't have to wait. We can file that because PSOB, it makes no difference to them whether they've been approved or disapproved by state. So if you know somebody who fits the criteria that has died between January 1, 2000 to now of cancer, and they were within 15 years of service of that diagnosis, then yeah, please get them in contact with us, and we'd be happy to work through and start that claim process.
And that is looking back, I guess, skipping forward in the presentation here. There's some numbers there. Any one of those numbers?
Yes.
You don't have like a direct line.
Yes. So contact myself or Chris Gorman at those numbers. Tammy has our email addresses as well. We're happy to do that. Pat Pollock, whose name's up there, is also a co-coordinator for the state LAST team. So that's why his name is there, because he is part of that, of the LAST. But Chris and I are the ones who are doing the PSOB stuff. So absolutely feel free to pass on either one of our phone numbers, our email addresses. I have business cards if you want to grab one afterwards as well, and we'd be happy to work through. Yes.
I think too, that was a really huge emphasis in Baltimore, is that the PSOB doesn't link up with the state. So if the state rejects even a cancer claim, it doesn't affect PSOB at all.
And we've had PSOB claims approved that LNI disapproved, and the Board of Volunteers disapproved. So,
AJ, then Ryan.
Thank you, Mr. Chair. Does this cover treatment leading up to, you know, if they're going to die, does this cover, or is it just a lump sum payment for
This is a lump sum. It doesn't cover.
no treatments,
or
just
anything.
so.
Yes.
So it says disability and general death and disability. Do they get anything for the disability?
So the disability claims, that's a difficult one because in the definition of the disability claim, the officer has to be catastrophically disabled.
Okay.
And what's difficult about that is if that officer can do anything such as like even answer a phone, he is not eligible for that catastrophic disability. They have to be catastrophically disabled. And I've not yet had a claim approved through disability because of that.
Okay. And then our members who have died from suicide, how are they going to track that down? I mean, how do you even start to prove that it's from PTSD?
So with that, typically there are, they have been, a lot of them are getting treatment. So we have notes from their psychologist or counselor that say this is their they've been diagnosed because they have to have a diagnosis, right? And then we also have to have statements from the family and statements from department members saying that this is how our lives have been impacted by their PTSD diagnosis and now their death, which is actually very difficult to process through. So yeah, we have to show they have a very, they say, you know, they have to be exposed to these certain types of incidences. So we have to have the department actually go and provide the run reports for those incidences that they were exposed to these types of certain types of calls. Yeah. Yep. And we will always do our best, even if we're not for sure this might or might not be eligible, we're going to go ahead and process it anyways, because it just might go through. Yep. And if a claim is disapproved by PSOB, the family then has a certain amount of time to appeal that decision.
Other questions? Go ahead, sir.
Thank you, Mr. Chair. Hey, thanks for being here today. I
Absolutely.
appreciate your information.
Thank you.
A question on the law enforcement side of things.
Yes.
So if a law enforcement officer has an issue with cancer, in the state of Washington, it's kind of carved out where it's kind of obvious, right? The firefighters are exposed to a lot of different things that law enforcement isn't necessarily exposed to.
Correct.
It's possible, depending on your job. But can you give an example where if an officer had a cancer issue and they went through PSOB, is there a process for like proving that exposure, or I guess how does that exposure process work for law enforcement?
So one of the things that we can do, if we can look back and find out that officer had been dispatched to a residential fire or an apartment type fire. So we can show that there was an apartment fire, that officer was on scene. That's an exposure. If we don't have those records, then what we can do, and I'm actually working with the fire department right now who doesn't have the records for these run reports. So they're putting together a statement saying, this officer was at this particular fire, and we have these other officers who were there as well and witnessed this particular officer at this particular fire. And that's what we're doing. Now, we don't know, because this is new with PSOB, we don't know if that's going to work, but that's the best that we can do.
Sure.
Getting affidavits from police officers saying, yes, I know that Officer Smith was at this fire because I was there and I saw him there.
Very good. Thanks.
Go ahead, Chris.
Yeah, I just want to add, thank you for being here. And as you say that, I think that this is more of a message to our public employers. There's a lot of discussion around public retention of documents and data retention. What you just illustrated is the importance of the run sheets you have in the fire service, but where we have a lot of our public agencies that are now destroying CAD entries after a certain date, you're complying with the records retention that the state sets out, but you're taking away the ability for our police officers to go back and find that dispatched call that you were a part of that led to the exposure that's part of this claim. So if we're in a hurry to get rid of publicly available information that hurts our claimants, then our public employers need to at least be on notice that they need to be a little bit more careful about how they set their retention schedules.
Yes, and I'm actually actively working with a fire department who destroyed their records because they had hit that deadline, and now they don't have them anymore. So we're having to go back and get those witness affidavits. Yep.
Chris, to your point, a number of years ago, our state council set up a program called PIERS, Personal Injury Illness Exposure Reporting System. And it's an app that we have on our phone, and we encourage our members to go on there and make their own entry. So they can put an incident number, they can put an address, and they can put the type of exposure. It doesn't need to go in great detail. As an example, we've added lithium batteries because nobody knows what's going to happen in the future. It's something we should probably talk to your group about making available. It's confidential, it's not shared, but it is a data program that allows our members, your members, potentially to do exactly what they're going to do. And so in the event you submit for a claim and it's challenged in some capacity, you have some documentation that may help come to a resolution will be favorable.
Yeah, right. The problem's going to be 10 years from now when that CAD entry is deleted and all I have is that I put in a file into an app. There won't be any sort of additional corroborative evidence that I was actually at that scene because that scene will, I mean, that call won't exist. It was deleted out of our file. So it might be the first step in preserving that claim. I just want to make sure that as we're thinking through retention schedules, as we're thinking through saving documents in the history of our cities and our counties, we're not so quick to get rid of that data because it may, this is the collateral impact to getting rid of evidence that would have been really helpful for somebody that might need to file a claim in the future, just because we're so worried about how much data we have stored.
But what that does is it gives us a starting point. And that's crucial. That's critical because I can go back and I can look at that app and go, okay, this officer was at this scene at this date. Now I can go back and figure out, okay, who was working with him on that day. Right. So it gives us a starting point. The other thing with the PIERS is what a lot of firefighters don't realize is there's a PTSD exposure tab on that. And I tell firefighters all the time, you need to mark that. If you're at an incident that you just walk away from and go, whew, that was a tough one. You document that incident. And police officers should be doing the same thing because if that PTSD claim ever came up, I can go back and go, I was on this call at this date. Right. So I can't say enough of how important that is.
Please don't take that comment as arguing against what
Oh,
you're
no.
advocating for. I totally agree. I just want to make sure that we have both sides of that. We have the file that is our first clue that there was an exposure. And then we have the back end evidence that's going to then say, yes, you were at that call and that exposure happened. So, yeah.
Mr. Chair.
Yes, sir. Senator?
Thank you, Mr. Chair. We have staff analyze this and find out if there might be a simple legislative fix to records maintenance in this lane.
Yeah, I have to admit, this is like my two worlds of experience coming together in a way I didn't expect. So the beginning of my career was in records retention and public records and risk management. So yeah, my brain is spinning on this, and I think it would possibly be in the scope of the Left 2 work because it affects Left 2 benefits. So yeah, definitely something we can look into.
And then just another comment. I do know that, Tammy, you mentioned the timeline. So we have an extension out to 2028 to go back and look and find those individuals that have passed away prior to 2020, I think it was. I can't remember if it's December.
If they die from between now and 2020.
2020, yeah. So we have a look back that's available to us. But after that 2028, December 2028, we can't go back anymore.
No.
And so I do know a number of organizations have started the process. I mean, as an example, New York City. I mean, how many thousands of firefighters potentially have had cancer who have moved away from New York, who now live in Florida? They have to go back. And so what we've started doing is encouraging our employee representatives, our employers, start to go through and shake those trees. Because if they miss the opportunity, they miss the opportunity. Mm-hmm. And so it's going to be, it's a big lift by everybody involved, but it's something that we need to do. Like you said, you know, those individuals who have passed, I mean, related to potentially occupational cancer or something else, they deserve it. Their families deserve this.
They do. So, yeah. And the volunteer side of that is just absolutely critical because they're just missed.
Yeah.
When it comes, especially to cancer deaths, they're just missed. And I know there's several that we could go back and find if we could, that would be eligible.
I did have a question on Part A and Part B. Employee was for Part A, employer Part B.
Yes.
Are the employers obligated to fill that out?
I want to say that's a yes and a no. That's a hard question to say absolutely. If the employer just refuses to do so, then the PSOB office then they then have to work with that. So I can go to the department and say, hey, I need you to fill out Part B, and they can go, no, we're not going to do it. And then so then I go to PSOB and say, the department refuses to do this, and then they will then take recourse to get that, to do that, or the family can take legal recourse, because we're looking at over $400,000 benefit that the department is holding them up, right? And one of the fears that departments have is that they're going to have liability because of this PSOB claim. And there is no liability on the department because of a PSOB claim. There is none, but there is that fear. And so some of them work on that. I did work with one department. It was very unfortunate. One of our COVID cases, they refused to talk to the family about the PSOB claim because they didn't want to give the family false hope. I absolutely did my due diligence to contact the family and could not get them to call me back. And they missed out on a benefit that that family really could have used. It was really heartbreaking. So I have run into that before, but it was on both sides, unfortunately.
It also speaks to the complexities. We talk about beneficiaries, but also the complexities at times when a firefighter has a rocky relationship with their department. There's a lot of difficulties sometimes that we run into with that we have to mitigate, and so they can be challenging.
Other questions?
Dennis, to your point, you did a great segue into my next slide. We recognize that it's really important to get the word out on these benefits, especially since we have deadlines that are needing to be met. So in addition to this presentation that I'm giving to the board today, we have put together a blog article. There has been and then we also put together an intermediate website for all the PSOB benefits on there and eligibility. It's pretty much the same as the presentation that we gave today, but in a website format. And the reason that we did that is twofold. One, when you go to the PSOB website, it's really difficult to get any meaningful information about eligibility and the benefits themselves, deadlines and all that. You have to go to you have to dig for the information. And so we put the intermediate page together so that it's more easily accessible for our members. The second reason we put that together is so that when people read that page, they can come to the Ombudsman's office, and we can not only refer them over to Pat and Chris, the experts for the federal benefits, but it gives Jessica and I an opportunity to review all the benefits that they may have been eligible for and maybe missed. And so we'd like to have that opportunity to speak with them, go through, make sure that they've got everything, and then pass them off onto Pat and Chris to finish that. And I have here on this slide the website for that intermediate page, and then also the congressional summary that I pulled a bunch of this information from. So you can go review that as well.
Good, thank you.
Mhm.
Do you, I mean, just a question maybe to the team, but I mean, contacting our active members is fairly easy. I mean, they're captive in some capacity. Our retirees, they spread out across the world. But if they're retired, they probably receive some communication through DRS.
The newsletter article, our newsletter, the dual response,
Yeah.
it's going to be going out here in the next couple of months, and there's going to be an article
Okay,
in that as well.
Thank you. I was just making
Yeah,
sure we.
that's what I was missing. I was trying to think of what the other thing was.
Good.
So thank you for the prompt.
Good, thanks. Hey,
Thank you so much for having us.
Tammy,
Thank you
Chris,
very
Pat,
much.
thank you. Pat, I know you're almost a quitter, but you got still some work to do, so, yeah. Yeah, yeah. 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 Thank you. Thanks, my friend.
The Quitters Club's a good club.
Yeah, it's a good club. Yeah. All right. Item number 3 on the list is the salary setting authority, and Karen is going to make that presentation. Thanks for coming forward.
Good morning,
Good morning.
Mr. Chair, members of the board, Karen Durant, staff to the board. And as Jason said this morning, this is like the 19th year we've worked on this. Even though it's only been 2, but it does feel like 19, doesn't it? By way of background, the LEOFF board bill, House Bill 2709 passed the legislature in 2018, allowing the board to set the salary for the executive director. Then in 2024, substitute Senate Bill 6197 passed the legislature, allowing the board to set salaries for the deputy director and the research and policy positions. In 2024, the LEOFF contracted with Troop HR to conduct the first cycle of market research that's required in the statute. Then the board in November of 2024 adopted the salary structure and process. The board adopted an ongoing process for the future based on the consultant's recommendations and best practices. Those included salary ranges being adjusted annually to reflect the Seattle-Tacoma Bellevue CPI, market analysis to be done in even years with the initial one completed in 2024, and the 2026 analysis is being performed currently. Performance evaluations will be a consideration. They were completed for 2025 and will be shared with the administrative committee and the board soon. Here is a reminder of the board adopted timeline process outlining the sequencing to have the ongoing process align with the appropriated, emphasis on appropriated, fund budget submittal process. As you can see, we are in the April-May timeline with the market analysis portion of the process. This year, because the April meeting, this meeting is early, and the May meeting is later, the board will receive market data and recommendations from the consultant at the May meeting. June will be to share the consultant's recommendations with OFM and request possible consideration. Any board action would be still at the July meeting. The current status is Troop HR is in the process of finalizing that market data, and you will receive a presentation of the findings and recommendations by the consultant at the May 27th meeting. Next steps. Consideration of modifications to the current process. Does the board want to make any changes to the process? During the consultation with OFM on the December executive director increase, one concern shared with the board was that we were considering an increase that was not included in the board adopted process. Allowing off-cycle increases would provide you with more flexibility. This could include for recruitment or retention reasons, alignment or compression and inversion, or recognition of outstanding performance. If the board wanted, we could look at modifications to the process for timing based on the non-appropriated budget process that we discussed this last year to align with the expenditure authority adjusted by OFM. I believe that the current process probably is fine with that, since there's a three-legged stool that we discussed that we still need to have the budget system align with the expenditure authority that OFM approves. So that concludes the presentation. More to come, 20 years and counting. Are there any questions?
Go ahead, Jason.
Mr. Chair, in the interest of kind of homogenizing this process that I think most of us thought we fixed, I'd like to make a motion to amend our board salary setting process to consider increases at any time, providing the board it increases our flexibility in order to make those decisions. That's my motion.
Right, a motion's been made and seconded basically to allow the board the flexibility to meet the needs of our group. Does that work for everybody? Exactly. I didn't write down what he said. But are we good? Okay, comments? Questions? All right, motion's been made and seconded. Seeing no comments or questions, all those in favor of adopting the motion say aye.
Aye.
Opposed? Motion is adopted. Thank you, Jason.
Thank you, Mr. Chair.
Thanks, Karen. Item number 4 on the list is the Catastrophic Disability Re-Review by DRS. Hey, Seth, good morning.
Morning. Thank you for having me. Once again, first time today. My name is Seth Miller, and I am the Member Experience Assistant Director for the Department of Retirement Systems. I'll be talking with you about a process that DRS has been working on with board staff over the last year to re-review catastrophic disability retirees. I've brought along a couple of colleagues with me, Ian Smith and Wes Parse, who are much more experts in this area, and we know that you all like to ask tough questions, so wanted to make sure we had the right people in the room to answer any questions that come up. And I'd also like to just from the start say, we're also happy to come back at a later date and present updates on this process if you have additional questions as we go along through the summer and fall. So I'm going to start off by just providing a brief overview of how people qualify for catastrophic disability. I know many or most of you are familiar with that, but for our friends on TVW watching, maybe they're less familiar with that process. So provide just a little bit of background information there. And then some background information as well on what the current population looks like who have qualified or who are currently receiving a catastrophic disability benefit. And then we'll spend most of the time talking about the re-review processes, actually 2 processes that we'll be doing later this year through the summer. So just for reference, I've included copies, links to the RCW and rule that govern the catastrophic disability process. To qualify for catastrophic disability, the first wrong in that is that the disability has to happen in the line of duty. So a person has to be injured on the job or in conjunction with the job. Appreciate the earlier presentation, I think gave you some sense of that as well. The disability has to be to the point where the person is no longer able to perform substantial gainful activity. The law specifically says that a person has to be in that state or expected to be in that state for at least a year or resulting in their death. And that's a pretty big range for a disability to last for over a year or result in their death. And what we frequently see when a person applies for this level of disability is that they're still in the process of treatment. And it is certain that the disability is going to last for a year, but is uncertain how much beyond that the disability will last. And so this re-review process is to see if they've reached maximum medical improvement as they have continued treatment or progressed in improvement or not improvement. So another part of the qualifying factor is that substantial gainful activity as defined by the Social Security Administration is any earnings that are over $1,690 a month currently. That escalates with inflation over time. There's also a higher threshold if the person is blind, but we don't currently have any catastrophic disability retirees who are blind as well. And then the law also requires that continued monitoring for eligibility is taking place. So that's why we're here today talking to you about the re-review process. So currently, there are about 75 folks who are currently receiving catastrophic disability benefits. This benefit's been around for almost 20 years. I know many of you were around as part of that process in moving it through the legislative process. And the average retiree who's receiving this benefit has been retired for already 10 years. So I just provide that as context. I think frequently people think about a person receiving catastrophic disability and assume that they only live a year or two beyond retirement, but many of these folks are living well past Medicare age. So. And if you want additional information about that, I know Mitch from the actuary's office loves this topic, does a lot of analysis on the cost for this benefit, and he's in the audience. I did not warn him that I was going to mention that he does a lot of studying of this benefit and this population more broadly. So we're going to be doing 2 re-review processes, and I'm going to first talk about the financial review. So in conjunction with that Social Security threshold of $1,690 a month, we're going to ask retirees who've been retired for at least a year to provide financial documentation. Usually this will fall in the form of a 1040, but we know not everyone files a 1040. So 1099s or W-2s or 1065s if they're self-employed, some documentation that indicates what their financial status has been for the last year. We want to make it really clear that this does not apply to survivors who are receiving a benefit. So if a catastrophic disability retiree has passed away, this will not apply to their survivor benefits. And if they're filing their taxes jointly with a spouse, we're going to exclude any income associated with that other person. So we're just focused on the income that is not from disability benefits, but from working, any sort of working income that they may have. And it's very possible that they will have no working income, but we want to see the full tax filing so we can confirm that. I'm going to pause here before I jump into the medical re-review process, because that's a little bit more to see if there's any questions. Okay, glad Pat's not here.
Yeah.
That's really the reason Wes and Ian are here, just to be safe. So the medical re-review process, we're going to be doing medical re-reviews every 3 years for people who have been receiving a catastrophic disability. But we're going to exclude anyone from the population who's already over the age of 65, and then also exclude anyone who, when the last review we did, had a diagnosis that was deemed terminal. So we're not going to ask for an update on their status. That's currently 3 retirees out of the population of 75. And then if we've done a review in the last 3 years, we're not going to be reviewing their disability status as well. So we have access to information from labor and industry. So if they had an ongoing claim, we'll be able to pull that information easily without them having to go through any additional process. But we will be contacting them a month in advance of starting the actual review process, letting them know that this review is going to be happening so they can gather this documentation. Especially, we know it can be a little bit challenging to get a hold of your medical provider or get information from a medical provider to allow a little bit of lead time. But we'll get information from the retiree, from the medical provider through the retiree, and then also from L&I or whatever documentation is available there.
Question for you. Would this require then a individual to go be evaluated again?
Ideally, they will have an ongoing relationship with a medical provider, and they'll be able to provide the most recent update. Yeah. Okay. So not necessarily needing some new full comprehensive review.
Got it. Thanks.
I think we're very... there's a bit of an unknown on how much continuing service or treatment they're receiving. And so what has been updated since the last time they went through the review process, I think is going to be an open question, especially if an L&I claim has been closed out. So the notification process, I mentioned this already, but we're going to provide notification to these folks beginning in May, letting them know that this process is going to happen to get them ready for it, so that way it doesn't feel like it's been totally jumped on them. Allow them to put that documentation together, and then we'll request the actual documentation in June, and we'll have follow-up notices in July if we haven't heard from them, and provide some sort of final notice. As we receive information back, we will start doing the review process. We don't want people to feel like they're waiting on pins and needles for us to get all the review information from everyone involved. If they provide us what we need, we'll get them going. But our intent is that we'll be doing most of these reviews in the fall, in kind of third quarter, July through October. And then our goal is to have all notifications out by the fourth quarter of 2026, in case there's any delay in the process of getting documentation to us. So as far as once the review process is done, if there's no change, we'll notify them that there's no additional action that they'll need to take. For medical reviews, we'll revisit them in 3 years to see if they continue to qualify. If a person no longer qualifies for catastrophic disability, it is very likely that their disability would be transitioned to a duty disability. The injury still took place in the line of duty. They would meet the qualifications for duty disability, and then that benefit would be a prospective change. We debated a lot on if we should share with you like an example of what that calculation transition could look like, but it's going to be very individual. It's going to depend on if they're receiving L&I benefits and Social Security benefits, those offsets. But as I mentioned, we'd be happy to come back and share down the road once we see what these transitions can look like, if anyone does transition benefits, and provide you a little bit more context of what that looks like. And as always, if they disagree with any DRS decision, they'll have the ability to go through our petition and appeal process to get into a court system if that is something that they feel is necessary. So yeah, in summary, really, we're going to be doing about 60 financial reviews this year, and we'll be doing about 10 medical re-reviews. And for folks who are receiving the medical review, they'll also be doing the financial review. So we'll be trying to coordinate those reviews at the same time. We don't want folks to feel like they get an approval on a financial review and then a denial on a medical review, trying to coordinate all of that together. And then for the medical reviews, we anticipate that we'll do about 10 a year to stay on track with being able to do them every 3 years. That's it for me.
Yeah, I just wanted to jump in real quick and just say that DRS has been communicating with us through this process. In fact, just recently they sent all of their communications. They're planning on sending members for us to review. I want to thank Tammy and Jessica, who did a very thorough review of that, much more thorough than I did, of going through it. And they know this member population, and we're really concerned with trying to make it as as clear as possible what this is about, what's required of them. So just want to thank DRS for that. And then just want to thank Seth for bringing Ian and Wes for coming. They are key partners for us when we work with, especially for our ombuds office. They're the go-to. They get us answers when you guys have questions. So it's just great to have them here joining us. So thank you.
Appreciate it.
Mr. Chair.
Senator.
Okay, another esoteric in the weeds question on the topic here.
We love those.
Oh, God, seriously. Seth, when you talk about 1690 earnings cap before the benefits affected, and it's Social Security that does this, that would mean that's a national standard, correct?
That's correct.
If you have right to work states, well, you know where I'm going with this, and you have specific states out there that have a higher minimum wage as a result of legislation, you may have a completely different standard for work expectations between states. How do we handle this?
It's a really good question, and my understanding is it's just based solely on the dollar amount. So the hours worked could be different. I have not seen any research on this, but I think it's something we can look more into to see if there's been some variation with how Social Security is handling that. But my understanding is Social Security is handling it just as the straight dollar amount.
Yeah, thank you.
Yeah.
Other questions? Right, not seeing any. You got off way too easy.
Way too easy. Was not expecting that. Appreciate it.
Sit there for a few minutes and we'll think of some.
Yeah, we'll be around. Thank you very much.
I can check the internet.
Yeah, thanks, Seth. All right. Next up, item number 5 on our list is the updated administrative factors And that's going to be presented by Jacob White, our Executive Director.
Hey, for the record, Jacob White, staff to the board. I'm still going to come down here to give these presentations where I'm more comfortable and got my screen. Yeah. Okay, the issue in front of the board here today is that OSA develops new administrative factors for left two members based on the board's adoption of economic and demographic assumptions, which you just adopted last year. And so those feed into developing these administrative factors. So this presentation, no action required of the board. This is just to notify you of these changes because it does have an impact on members and may be something that you hear questions about. So here's an example of how those adoption of the economic and demographic assumptions last year, what goes into those, and then how those feed into the admin factors. I was telling me and Mitch, our actuary Mitch, we're talking about this beforehand, and it's always just kind of a logic problem of trying to figure out why these go up or down. And so he's here if you want to ask questions about that. Okay, so admin factors are intended to be actuarially equivalent. However, experience can be different. Members can live longer than expected, investment returns can be lower, and members may, the actuaries call it anti-select based on their health, so they choose options based on like a survivor benefit based on if, more likely to choose 100% survivor benefit if they do not expect to live long or vice versa. And then what happens if the factors aren't actuarially equivalent? There can be a cost or savings passed on to current members and employers. So there's two types of benefits that use these admin factors. There's the reduction factors that reduce monthly pensions to pay for optional benefits. So these would include early retirement, a member choosing to retire early, and the reduction in benefit they take for that. And then joint and survivor benefits would be the other one. And then the other type of benefit are annuity factors, and these allow members to convert between a one-time and lifetime payment. So you take your 457 account, you purchase an additional annuity with that. And so these factors go into that, determining what that ongoing amount is. And so got a handful of slides here. They're just going to show you some charts to give you an idea of what these changes are. So this is a comparison of the joint and survivor factors. And here we can see just kind of look at the percentage change for members. And so this is for them, someone choosing a joint and survivor 100% benefit would see a 3.6% less of a reduction after these new admin factors go into effect. So here there's a improved benefit for members. And here we have an example of the impact on an actual benefit, not just that percentage change. So here's someone retiring with a $5,000 single life monthly benefit, choose the JNS 100 survivor option, and their beneficiary is 3 years younger than them. So they're going to see a change of $150 more a month in benefit after these new factors go into place. And so the reason for this, Mitch actually just told me this one, the reason for this that comes into play here is that life expectancies are up. So the member is expected to live longer, and that means the survivor will receive a benefit for a shorter amount of time, which increases the monthly benefit for the member. And so that's an example of what feeds in to make these changes, what assumptions feed in to make these changes. Okay, and then here we have the comparison of annuity purchase factors. So once again, this is for purchase of additional annuity or the purchase of service credit, not the service credit restoration, but the purchase service credit annuity, which is always confusing to explain to members. And here we see that there is a greater reduction will be applied because of with these new factors. You see the percentage change over there based on the age of the member when they're making this one-time purchase of an annuity. And then here's an example of someone retiring at age 57, making a $100,000 annuity purchase. Give you an idea of the dollar change, monthly dollar change they would see on that of $15 less. So next steps on this are the changes are effective January 1st, 2027. DRS notifies members by having a notice on their website. And then member retirement estimates will be updated with the new admin factors based on the retirement date that the member selects to make sure they get an accurate estimate based on their retirement date. So that completes my presentation. Any questions?
Senator?
Well, thank you, Mr. Chair. I guess this is Jacob's more for Mitch. Mitch, are these actuarial offsets pretty consistent throughout all the systems?
I knew I wasn't going to be able to lurk in the back for this whole presentation. Yeah, Mr. Chair, members of the board, for the record, Mitch DeCamp, Office of the State Actuary. Yeah, they are pretty, so as Jacob said on his first few slides, they are dependent on the economic and demographic assumptions. The LEOFF plans had a little bit of different changes from the demographic assumptions from the other plans. So yes, if the assumptions move the same, all the plans will experience the same. I can't recall off the top of my head if, say, PERS moved the exact same as LEOFF. I don't want to speculate right now, but
I'm not talking, three places to the right of the decimal point. Just generally, do the longevity and offset. And the only reason I'm asking is we have early retirement, age. 53 years old. Some draw at 51, 50, kind of a thing, depending upon the penalty here. But going forward on something like this, a lot of the systems start in your 60s. So I mean, is it just simple? Demographic assumptions as to the, generically population-wide, the longevity is this, that the differential is this. Is that fairly consistent throughout the systems, or is LEOFF unique because of the age difference?
the LEOFF plans will have a different impact on the admin factors from the assumption changes because they do tend to use the factors a little bit earlier. You're right. We set factors. We determine these factors based on some average age, and for LEOFF, the average age is a little bit earlier, so they do have a little bit of a different impact from the changes in assumptions. If that helps.
Not sure who it would be for, but the 3 years younger than the member, how was that determined? I'm just curious how you came up with 3.
Well, I think this.
You know the answer.
Yeah, they knew that my wife is exactly 3 years younger than me, so they wanted to make it.
It is all based on
specific to me,
AJ.
yeah.
It is AJ's world. I know.
Yes. You're talking about for the JNS factors.
Yeah.
That is just an example. We
Okay,
actually do an entire table
Gotcha.
on every different age difference. I think
Gotcha.
it goes all the way to 20 or 30 years difference.
Poor person.
Yeah.
Any other questions? Right. Thank you.
Forgot to let you sit in front of the camera.
Right. Jacob, you're still there. Item number 6 on our list, which is the 2026 interim planning. A potential action by our board.
Okay, so before this, I've got a little multimedia surprise for you guys. A video. I've got Kleenex by Dennis because he looks like he might be kind of a crier.
I heard it was kind of sad. I don't
think it was that sad, but we'll see. I thought it was funny. So I was very surprised that leading into the Oscars, I saw there was an animated short nominated called Retirement Plan, and I had to watch that and showed it to the team. And we thought it might be a good kind of kickoff for the interim planning presentation, kind of a fun look at what we do and why we do it. And yeah, so start that.
When I retire, I will reply to every email I've ever flagged. I will clean up my desktop. I'll read the 35 years of saved articles on my reading list. I will finish all those books I started. I will play the lifetime of computer games I missed out on. I'll birdwatch. I'll learn magpies are beautiful, but terrifying. I'll learn the names of trees and know which spring flowers bloom first. I will swim every morning. I will learn to play a single piano piece exceptionally well. Write a devastating yet optimistic piece of poetry. When I retire, I will get a dog. I will get a cat. I will start with a fish. Maybe a terrapin. I will learn how a terrapin is different from a turtle and how that affects my choice. I will hike. I will see a point in hiking. I will know when a walk becomes a hike. I will get so good at meditation. I will be so present, so aggressively present. Then I will patch that hole, replace that button. I will learn how to juggle not just a 3-ball cascade, Rubinstein's Revenge. I'll organize my digital photos, then my wardrobe, then my drawers, then my pantry, inspired by that book about organizing that I finally read. I will have to buy so many plastic boxes. Retired me will have so much money as a result of the pension I haven't yet started. I will find out what a pension is. I will order wine by year and specific area of Italy, grazie, but not in an annoying way. I will learn to like whiskey. I will get good at saying yes. I will get better at saying no. I will cry more. And less. When I retire, I will make the perfect meatball and pair it with a 2019 red from Tuscany. The rain that year, my God, you can taste it. I'll smoke weed all day long, or try some other drugs. I'll Google microdosing and start there. I will stretch. I will yoga. I'll drink 8 glasses of water every day. I'll sleep for 8 hours every night. I will see a play. I will see if I like plays. I'll give back. I'll know who to give back to and why I want to give back to them more than the others. I will eat more vegetables. I will grow a vegetable. I will find out what to do with a leak. I will find out what a leak looks like. I'll fight a man. I'll kill a fish. I'll drive a bus. I'll drive one of those airport cars. Nobody's going to stop me. I'll travel more. I'll travel more. I'll travel more. I'll get a telescope. Get into camping.
No! Camping is horrible!
finally find my sport. I will paraglide. I will not paraglide. I'll move to a town by the sea. I've always loved towns by the sea. I'll remember to breathe. I will learn to speak another language. I will learn to tell people how I feel. I will take better care of myself. I will take better care of my body. I will take better care of my teeth. I will take better care of my mind. Meet up with that person. Have that conversation. I'll go to an art gallery. I'll want to be there once I get there. I will completely nail my final words. I will haunt the absolute shit out of my 6th class enemy, Deirdre Hogan. I'll finally know if you have the time you have and then it ends, or if there is more time.
Yeah. Just for the record, Ryan Reese turned off his camera, so I assume he probably had a tear or two. Kind of that's why he did it. You okay, Ryan? Not okay. Yeah. Welfare check. There he is. Got his.
Okay, well, hopefully I don't get in trouble for a couple of scenes in that, but yeah.
Oh, great. We all make choices. You okay? What else you got for us?
So I just had to share that because we shared it with the team as kind of a kickoff meeting and us kind of having a discussion of big picture of what we do, why we do it, why we enjoy doing this, how we can help people. Obviously, there's a lot you can take away from that. You can't, obviously put everything off till retirement, but we do want people to be excited for retirement. And it made me think a lot about the director of DRS. And last time she spoke to the board, and she was paraphrasing one of her team members, but using the term the Department of Future Happiness. And I think that's a big part of what we do. It's always a hard question to ask people, like, what are you going to do in retirement? And that always feels like a very unfair question because, who knows what your situation will be, and it's hard to plan for the future. But the one thing that, left to in pensions and the benefits that this board has passed is giving people options, giving people the freedom and ability to do that. And so that's going to be part of this interim planning I'll get to in more detail. But having the ability to take a step back, look at some of the big benefits this board has passed and how we might be able to better utilize those, educate members, and do more with those. So with that, I'm going to move forward in the planning. And also, I just like movies, and so an excuse to my first board meeting as director to make people watch a movie. That's those who know me are not surprised at that. Okay, so first, actuarial presentations. So these are the typical ones the board would do at this point, and we already worked with the actuaries this year, and have worked with the actuaries on identifying what month those would need to be done. And so the big thing, I'm not going to read through all of these, but just that the board will be setting contribution rates this year. There's been some work the last couple of years previewing that, So that's going to be a big responsibility on the board this year, going into next legislative, adopting those and then going into next session. So just want to keep that in mind as we look at the other items on the agenda. And then I swear this grows every year. We've got administrative presentations. I have to get smaller and smaller font to fit them all. We've got 16 on there. Once again, not going to read through all of them. A couple, let me see, one that I wanted to draw your attention to is the annual Attorney General training. So I've talked to Kate about that. And there was questions that came up over the last few months with the LEF 1 termination bill. And there was questions about whether the LEF 2 board would take on some responsibilities around governance and whether that raised any fiduciary issues. And so I had a chance to communicate with Kate about that. And so she's going to work on the presentation. On her presentation, we'll talk about that and then also cover some general ethics like we would typically do. So excited about that. And thank you, Kate, for being willing to take that on. And then this year, we do also have the financial and performance, financial expenditure and performance audit results. So we've got 2 of those this year that staff will be working on and you'll get presentations on. Yeah, other than that, I'll skip through those. So then just a reminder, the types of benefit topic briefings. We don't always have this first one on there for you guys, but this one included the legislative study. So that's the board occasionally has studies that are mandated by the legislature. And then also the board typically will get some educational briefings. These are types of presentations that are made by staff, or we have others like today come to the board and present. And just to let you know, that is something I'm going to look for more opportunities for. I think it was great today to have some other speakers come and share their perspective and their experience, their knowledge. And so we'll be, as LEF 2 board team, we'll be looking for more opportunities for that moving forward. And then our typical policy briefings also, where we would have initial consideration, comprehensive, final. Sometimes, obviously, if it doesn't move forward, we don't have all 3. And then sometimes if it's an issue the board's already considered, like last year or previous years, we don't always do all 3 presentations. Okay, so first, the legislative policy topics. So the first one is the study of enrollment of Department of Natural Resources, Wildland and Aviation firefighters in LEF 2. So our report to the legislature is due January 1st, 2027. So this is one where there's no expectation of the board making a recommendation. It's similar to the tribal law enforcement officers study we did, well, now it's been a while, 5 or so years ago. Where we're just gathering information, data, analysis, identifying potential issues, and then putting that in a report to the legislature. We've already, me and my replacement, Dave Dunlap, him and me have already reached out to DNR and are working towards scheduling a meeting with them before we move forward with next steps. And then we'll also be working with very closely with DRS and OSA on that. So I would expect at least 3 presentations to the board on that issue. And then the second study is the so it was actually a study for the Select Committee on Pension Policy. And this is what I alluded to earlier, the study for what is now called what will be called the restated LEF plan for oversight of that plan. So that's after LEF 1 terminates, and then it's reinstated as the restated LEF plan. There'll be the Select Committee is going to be studying who should have oversight of that. Specifically, they need to consider the language said they need to consider whether Select Committee should continue to have oversight like they have for LEF 1, whether that should move to LEF 2, or they can consider other options if they like. The language of that said that the LEF 2 board shall provide assistance to the Select Committee as requested. At this point, I've had some initial conversations with Select Committee, but they haven't had a meeting yet, and we don't know what assistance that will be. But I would imagine that I will be doing, or that we will be doing some presentations to the board, at the very least to update you on the progress of it, but also if we get specific questions that the select committee wants feedback on. Also, the legislature gave select committee 2 years on that one, so I'm not sure how quickly they're going to move through that. But want to at least have that on the agenda because it might be part of the workload this year. I guess before I move on, any questions on those two? Okay. Okay, now we have the educational briefings. So one you already got today. So the first one, public safety officers benefits, already received that one earlier. And then the second one is one I was mentioning earlier. So this is one that staff is recommending to the board. And this would be a series of presentations, of educational presentations on the purchase of additional annuity or the purchase of service credit annuity benefits. And so I just want to give you some background on why I'm recommending this one to you and kind of what I see as the possible plan for it moving forward. So this idea really started a couple of years ago and came from me from a personal standpoint of my dad was getting ready to retire. He's a wireman for Chelan County PUD. He was in PERS. He'd worked about 20 years, and so he had a decent amount of pension. But he was lucky in that his employer did a matching for their 457, which I know a lot of LEOFF employers do too. And I think from talking to LEOFF members, they sound a lot like my dad in that if they didn't get every dollar from their employer with the matching, they were giving money to their employer, which is I think a great incentive for saving more in your 457 plan. But members end up with that money in their 457, and they don't always know about these benefits. And talking within the kind of the policy, with the pension nerds around the state who really, look closely at this stuff and follow it closely, this is seen as a real great benefit. It doesn't mean it's for everyone, but I went through the process with my dad of telling him about it and why I thought it might be good for him. How it's purchasing more. You think a DB is better than a 450 or 401k. This is purchasing. It's like purchasing more of a pension benefit and kind of the perks of it as far as having a guaranteed income stream, getting a COLA, leaving a survivor benefit, and it took me many conversations to convince him of some of the benefits of that. And then after retiring, it's been him thanking me at least once a year when he gets his COLA, and he calls it his raise and lets me know about it. And so it's something that when I've gone out, working with him, talking to him about that, and then going to some of the member outreach events we go to and talking to police officers and firefighters that are getting close to retirement. And there's just a lot of misconceptions or just lack of knowledge about it, or of why they would want to do this, what the benefits of it are. So it's something we've been talking about internally as a team. And I've been reaching out and talking to our partners at DRS about it. And so my idea with this is we could do multiple educational presentations. Those could possibly lead to policy ideas. They could lead to more communications ideas, partnerships with DRS, with employers, with unions. So some ideas I have bullet pointed there. Possible presentations could include an initial one with kind of background and data. For example, I've already talked to Seth at DRS about this, that about 10% of retirees in LEOFF 2 have purchased one of these benefits. Not sure if that's high or low. It seems it was less than I expected, but we could dig into that more, get more information. Also, DRS is coming up on the 10-year anniversary of their auto enrollment into the state's DCP plan, state's 457 plan. That doesn't impact many LEOFF members. It's only state employees, or at least it's for most of the 10 years, it's only been state employees. There was just recently legislation passed that allows local employers to do it. My understanding is only a few local employers have taken advantage of that so far. But it's had a dramatic impact on the number of state employees saving into the state's 457 plan. And when those employees get to retirement age, they are going to have this option to purchase an annuity. And so you're probably going to see more people doing that, at least more questions. So I think it would be interesting to look at that with LEOFF employers and LEOFF members also. And then I've had a chance to talk to Tim in our office about, he's very involved, as you all know, in what goes on nationally with the organizations he belongs to, and taking a look at financial planning for public employees and national trends in that, that there might be some opportunities there as well for either policy, communications, education for our members. And then also we've been looking at communications. So Jesse on our team has been taking a lot of communications classes and getting excited about that over the last year. And we've, as a team, started to talk about some possible options we could have to, as I've been told, people don't read anymore, short videos, quick videos of trying to do some, and I think what we've learned too as a team is that firefighters and police officers would rather hear from police officers and firefighters. I mean, I experienced that same thing with my dad and trying to convince him that the other wiremen, that I might be a good resource too on pensions. So finding ways to reach out, talk to firefighters, talk to law enforcement officers, and then package that, communicate that, have a plan to help educate our members, and then have that kind of baseline data already gathered and have some goals around how we want to impact our members and show that. So that's my, so those are the educational briefings, ideas. That one, like I said, that will be, I imagine, 3 or so staff presentations. We'll try to spread that out on which staff do those presentations, and then also work with our partner agencies to have them participate in those presentations and present on their own as well. So I'm excited about that. So any questions on those, or really on that last one? Yeah.
Thank you, Mr. Chair. Just a thought for material on the presentations. Probably way past pull date on this information, but back in the 80s, we had a window of opportunity for employers to opt out of Social Security, members to opt out of Social Security. And if I recall correctly, what we did is we negotiated the 457 matching on that, equivalent to what the Social Security contributions of the employer would have been at the time. Seeing that's no longer the case running in front of us, can you also add to the information to provide the universality of the matching of employers at this part as part of a total compensation package? Back then it was something was a given at that point. Is that still happening, and is it waning? Is it increasing? How does that affect all members across the board? Appreciate that.
Yeah, I would love to do that. I know before my time with the board, there was a big survey done of employers, and we've talked about updating that in recent years. But I think this would be a good reason to look at least updating some of that information in there, and would be, like I said, it'd be great to develop a baseline of where we're at before then we start a communications plan or changes in policy, so we can really see the impact of the board's work. So thank you. Okay. So now policy briefings. These would be the more traditional 3-step process policy briefings. The first one I have on the list is standby pay. And this, the board endorsed legislation on this issue last year that would add standby pay to basic salary and align LEOFF with the other pension plans in the state. It did not pass. It got a hearing in the Senate, no hearing in the House, and did not move out of the Senate after the one hearing. So over the last couple of years, the board studied this. We gathered data. We may have to gather more data if the board moves this forward, but would work with the actuaries on what additional information, if any, they would need to study this again. And it would not require all 3 presentations. I think it would likely be 2 presentations for staff. Next on the list is the COLA Bank. And so this issue was studied in 2024 and then tabled for future consideration. It's one that we've got questions about since inflation was high in recent years, and retirees saw their COLA bank grow and grow, and started doing the math on how long it would take before that COLA bank emptied out. And so in 2024, the board worked with the actuaries to do a simple pricing, or at least relatively simple for them to do, not simple for me to do, on what it would cost to pay out those the COLA banks. And so at that time it was 650 million, and it would have lowered the funded status of the plan from 102% to 98%. And so at that point, the board tabled for future consideration. So I'm bringing it back in front of you now to consider whether you want to study that further this year. The next one is survivor benefit vesting. And so this was a letter to the board in late 2025. So it came too late for the board to go through the policy study process. And so the board asked for it to be tabled for consideration this year. And so the issue here was a letter from a survivor of a member who had passed away from cancer. He had a little over 9 years of experience, was not retirement eligible. You have to have the way LEOFF and the other plans are designed. You have to have 10 years of experience, 10 years of service to qualify the survivor for an ongoing benefit. And so the survivor had only received, it was only due a lump sum payout of contributions, no ongoing benefit. And so she wrote the board asking that you consider lowering that 10 years to 5 years, or having some sort of sliding scale where it'd be some sort of benefit. So that's why that one's in front of you this year. And then number 8 here, we've got career choice, employer mandated 457 contributions. And so this came to the board from Representative Burnett, and the board chose to table it last year for future consideration. And just a quick reminder of what this one would do is when a left to retiree goes back to work in a non-left, so in a PERS job, a non-left job, they have an option. They have choice. They can rejoin, or not rejoin, they can join PERS, and that suspends their left pension until they separate from the PERS job, and then they get that suspended pension payment, and they've earned service in PERS and potentially a PERS benefit. Or they can do what the vast majority of left to retirees do with career choice. They can continue to receive their left pension and forego getting a service credit in PERS. What this would do is, for those members who make that choice, the employer would be mandated to make the contributions they would have had to make in PERS instead into the member's 457 account. And so the thought was that the employer is getting a benefit by not having to pay those PERS contributions. And so this would instead put those what they would have had to pay into PERS, if the member had made that choice, they'd have to pay into the 457 account. So the board, like I said, did not move forward with that last year, but wanted to table it for this year for consideration. Okay. And then two more, Representative Burnett. These were both bills that he endorsed this session that I wanted to put in front of the board for consideration. So the first one would permit retired left to members to serve as chiefs of police in small police departments. It was by small was defined as less than 50,000. The actuaries did an analysis of that, and it would be about, I think they said 150 departments would qualify for that. And so what this was sought to do, my understanding of it, was to help with recruitment in these small police departments by creating a larger pool to draw from of retired left members. And then last on the list is changing the benefit enhancement date for determining eligibility for the tiered multiplier benefit. And so this would have moved the date back. So there was from February 1 to January 31st, 2021. And this would have allowed those members that were just one day off from having that choice between the lump sum benefit or the tiered multiplier benefit. They would get that choice. So instead, right now, they just get the they qualify for the lump sum benefit, not the choice between the tiered or the lump sum. So it'd move it back one date. And that is an issue that that the board has studied in the past, received communications about, and has chose not to move forward in the past, but still wanted that in front of you if you wanted to consider studying it again this year. And then we've got, thank you, Tammy. We've got number 11 that I think was added earlier today. And that would be the retention policies for records. I'm not sure how to word this one exactly, but the one we discussed earlier about PSOB records, let me see, records retention schedules related to records for duty, for disability and death benefits. Yeah, that's a mouthful. So we'll work on that title later. But yeah, so that would be for us to look at what those retention schedules are and whether they make sense with the information we got today about the difficulties caused by employers following records retention schedules, which there's definitely, what they're told to do and directions they have. But with these benefits being so dependent on having those records, whether the board should look at having that changed. So any questions about those? Yeah. Okay, so I probably didn't make this any easier, but after the last few years of trying to name numbers and go through it all, I tried to break this up into two possible motions for the board. The first motion is the one that typically the board approves all these, moves forward with them. And then the second motion will be when we get to the more traditional policy items of where there's potentially 3 presentations in legislation, that those will be a second motion for you to consider. So the board has the option here to adopt the following interim agenda items: the complete list of actuarial presentations, the complete list of administrative presentations, the 2 legislatively mandated policy reports, and then the 2 staff recommended educational policy topics. So I'll pause if the board wants to.
Yeah, Mr. Chair.
Go ahead.
Yeah, so I'll just break it up into kind of a 2-part motion based on what you said there, Jacob. And just for clarifications to those listening and those here. So in reference to your notes for board members on page 85, I'd like a motion to adopt the 4 actuarial presentations. And then our list of administrative presentations to include the legislative mandated policy reports, and also including the educational policy topics. And then for board members moving to page 86 and those listening, my kind of part 2 of this motion is to adopt agenda items number 5, which is standby pay. And number 9 is permitting retired members to serve as chief of police in small departments. And our added policy topic number 11, which I'll call retention schedules as it relates to PSOB. Thank you, Mr. Chair. Yeah. Well, I'm here for you.
So there's a motion. Is there a second? Motion's made and seconded, and again to adopt on page 85, the 4 actuarial presentations, 16 administrative presentations, and then turning to page 86, items number 5, 9, and adding number 11, which is the retention schedule related to PSOB.
Correct.
Questions? All right. Not seeing any questions or comments. All those in favor of the motion, please say aye.
Aye. Aye.
Opposed? Motion carries. Thanks. Thanks, Jason, for that.
Thank you.
Very helpful.
Thank you.
Good. All right. Item number 7 on the list is the administrative update, and I believe Karen's going to provide that. Yeah.
Again, Karen Durant, staff to the board. I realize I made an error in my original presentation. I should have pointed out that Mitch was here in case you all had questions on that too. So Mitch is here and he'd be happy to answer salary questions as well. Brief admin update today. Today's board was our very first TBW Live. Acknowledgement to Jesse, who worked hard with TBW to get us all set on that. A new thing moving forward, and Jacob's first meeting. Last week, Jacob attended the first tribal compact meeting with the Puyallup tribe on April 11th. You have anything that you want to add on that?
No real update. It was just an initial negotiation meeting to just set up kind of what the process is going to be moving forward. It's been, like I said, with the study, it's been like 5 years in the making. So I'll be excited to report back to the board on how it goes and if and when we get the first tribe to join the system.
As mentioned earlier, today is Dave Dunlap's first meeting with the Left 2 board. Yay. And Dave and Chloe Drosby attended the Fundamentals for DRS training April 6th through 10th. As we've mentioned a number of times, there's a desire to have increased collaboration with DRS. And this is just kind of an original way of getting all of our staff educated on base concepts with DRS and moving forward. Upcoming stakeholder outreach. We have Seattle Fire Local 27 Spring Financial Wellness Seminar on April 22nd. We have the Council of Firefighters Educational Conference on April 21st through the 23rd. Jacob and Tammy will be presenting, and Tim and Jessica will be attending. WACOP Spring Membership Meeting is May 7th and 8th. Tammy and Jessica will be providing an outreach table. And WASPC Spring Expo and Training is May 11th through 14th. Tammy will be there with an outreach table. Our next meeting will be May 28th, 27th. Okay. Do we have a motion on that? Just kidding. Any other questions? Anything to add?
All right,
That's it.
questions? All right. Number 8 on the list is the public comment section, and the Left 2 board welcomes public comment in advance of all meetings and has posted instructions on its website for the submission of written comments. We have received comments we had a first name only, Sam. So regarding part-time firefighters being included in the Left 2 pension system, and they were distributed to, those comments were shared amongst the board members in advance of today's meetings. Thank you for your comments. And if you have things, please post them. And that's it, I think. Anything else before the board? You got something?
I think we're good other than lunch.
Okay. All right, I entertain a motion to adjourn. And seconded. Motion made and seconded to adjourn, and we'll see everybody on May 27th. Thank you very much.